There was a time in the history of the United States of America when a person needing medical care could pay for it out of their pocket. So why is it today the average American requires assistance in the form of insurance to pay their medical bills? Why is medical care so expensive? To answer that question, you have to keep in mind that medical care is a service, and that means it's subject to economic laws. Let's start with hospitals. Public hospitals have been receiving federal and state funding since President Truman signed into law the Hospital Survey and Construction Act, or Hill-Burton Act, of 1946. The act granted money, $375 million over 5 years, to states for the construction of new public hospitals and modernization of existing ones. Well, despite the good intentions, the act actually created and propped up a lot of economically non-viable hospitals. This legislation created countless inefficient hospitals that couldn't support themselves due to the lack of knowledgeable doctors or trained staff, misallocated spending on technology, and even too few paying patients. So as time marched on and the money ran out, all hospitals had to choose between raising their prices or accepting payments from Medicare, Medicaid, and private insurance companies. Today, cash-strapped states can't afford any more subsidies for public hospitals, and the steadily declining rate of reimbursement from Medicare and Medicaid only raises prices higher while reducing the quality and availability of care. So how do you lower the cost of hospital care? The best solution begins by ending state and federal subsidies to public hospitals. No longer supported by the states, these public hospitals would have to become private hospitals. With no alternative but to rely upon patients for income, hospitals would be forced to lower their prices and compete with each other. Those that can't compete would have to close, leaving only those that could provide the best care at a reasonable price. Focusing on quality patient service would also enable hospitals to become less reliant on reimbursement from Medicare and Medicaid. Contact your state and federal representatives and senators about stopping subsidies for public hospitals and ending support for Medicare and Medicaid.